Robinson AI Talks, where high-caliber industry leaders meet with top faculty from Georgia State University, Robinson College of Business to explore the research, trends, and hottest topics shaping AI and technology today. These are the conversations that matter, bringing together executive insight and academic expertise to move the needle on what's next. Hope you enjoy this episode of Robinson AI Talks.
Hello, I'm Dr. Beverly Wright, and welcome to Robinson AI Talks. With us today, we have Russ Johnson and Saeid Motevali, and we're talking about healthcare AI from innovation to real-world impact. Such an important topic. Thanks for being here, y'all.
Sure, happy to be here. Thanks for having me.
Thanks for the invite.
Yeah. So let's start off with a little bit of background. Russ, why don't you tell us more about you?
Sure. So Piedmont Healthcare right now, I'm on our business intelligence team. And my primary role there is to lead project delivery, which includes a lot of time focused on getting the right people onto the team. And our team has gone through some substantial growth. I've been there for about 5.5 years at this point. I think when I joined the team, we had 33 people. We're approaching 60 at this point.
Wow. How many years?
5.5 years.
Wow, doubled.
Yes.
Doubled pretty much, yeah.
We're a rapidly growing team within a rapidly growing organization.
Amazing.
Quick overview of my career. I started at KPMG in 2003 during the Sarbanes-Oxley days. I will spare you the explanation of that. If the listeners want to go Google that, feel free. Spent 2.5 years there, and then left and went to Cox Enterprises into an internal audit role. And through building relationships around the company there, switched from audit to business intelligence.
And that's when we met.
That is. We were at Cox together, and I ended up leading the build out of the Tableau server platform for all of Cox's companies, and kind of got to be known as the Tableau guy, and built some relationships there, or reestablished relationships through the Tableau community that ultimately led to an opportunity to go to Piedmont. So that was my resume in about a 30-second nutshell.
Love it. Thank you. Saeid, you're kind of a pracademic, so tell us more about you.
I started my master's, like a first master and second master. The second one was at Georgia State in computer science, so technically I'm a computer scientist. And I did my PhD in computer science from Georgia State as well. I work with Trend Center, and I worked with a lot of medical data during my PhD years. After my PhD, I started Clinical Assistant Professor position at Georgia State, but in Robinson College of Business. So I moved a little, and now I'm more interested in research in terms of medical management, and like not only purely toward like a disease and the disease diagnostic. Like now I'm more into management of healthcare.
Nice.
Okay.
Love it. Awesome. Well, thanks for being here to talk about healthcare AI. Let's start off with just people are always trying to use more AI and leverage AI for its power. And healthcare is obviously a really important field, especially as we have this population where everybody is relying on healthcare. Where are we seeing some of the top use cases within the healthcare space that are kind of practical AI, if you will?
I'm glad you said the word practical, and because that's what I was thinking of. You do actually hear these, I would say, outlier type of scenarios. Coincidentally, my brother-in-law forwarded me an article this morning where some researchers were putting AI to analyze EKG data, and they identified some patterns that had never been noticed before that can be preemptive predictors of heart attacks in younger people. That's a pretty outlandish outlier type of use case. Very valuable, and I expect many of those to be appearing over the next few years. But I'm really more in the world of the practical. Like, how can we leverage AI to find low-hanging fruit, easy value? And there's some pretty easy examples of that. The one that's probably most common is you hear about providers who are using AI listening devices in their interactions with patients to help transcribe their notes to prevent what we call pajama time. So a lot of providers will work an 8 to 10 hour day with patients, and then they have to spend several hours at home in their pajamas just to write up their notes.
Right.
So that's a great time savings there. There may not be actual financial savings there because you're not necessarily hiring or reducing staff, but you're reducing that burden on the provider so that they can provide better care.
Mm-hmm.
Another example is really nothing to do with specifically healthcare, but the concept of a help desk, a patient care phone call. So if you want to call in and schedule an appointment, there are some pretty good tools available in the market for managing your patient connection center, your call center.
Mm-hmm.
And they can do a lot of the, I'm not saying heavy lifting, but more like the volume, heavy volume calls,
Mm-hmm.
scheduling, rescheduling, cancellations. There are tools that you can implement there. Now, they're not going to do the more complicated things. And currently, the way that most organizations are deploying that is they have that as kind of like their entry point, but you can quickly escalate to a human to answer anything. But there's lots of examples like that are not these outlandish, we're going to cure cancer kind of things, but just fairly quick wins where we can lower costs, we can identify efficiencies, or just improve the employee or patient experience.
Right. Right. Simple. I mean, tasks that we've seen done fairly manually with a lot of work, or improving the employees' quality of life. Like doctors are not wanting to be doctors if they're having to burn their evenings every night to write down patient notes.
Yeah.
So these are very practical. I had a colleague tell me the other day that he went to go park somewhere and he couldn't get the app to work. And so they called him and said, "Hey, were you trying to park?" I mean, it was an AI.
Wow. That's awesome.
Yeah, and he said, "Yeah, I was." And do you know your license number? And he's like, "Oh, I'm in a rental car." "That's okay. What city are you in?" And there was a camera, and they said, "Well, what color is your vehicle?" And it's like, "Oh, well, you're the gray vehicle in this location at this moment. I got you."
That's
know.
fantastic.
And so doing
I
things
love
like that, like when you arrive to the doctor's office or something like that, thinking about it from a patient standpoint. So just simple things. I love that. What do you think, Saeid?
I agree with Ross. I think he's really right about how the AI can really help the healthcare. It's not only toward a disease control and disease diagnostic. It's actually more into more of an admin side, right?
Mm-hmm.
So I think I see a lot of problems in terms of patient experience, right?
Mm-hmm.
So medical records, they're one of them. For instance, from the patient point of view, when you go to any a healthcare institute, everything works in their system. But as soon as you walk out and go elsewhere, it's a hectic.
It's different.
It's
Yeah.
very different.
Mm-hmm.
It's really hard to get all of that data, right? Technically, it's a patient data, but it's really hard to access that. So that from patient point of view is really troubling. I think the other problem is in terms of efficiency, right? So hospital beds, we can look into those things. The scheduling, those are the problems that we actually have in our healthcare system. We can actually improve that, right? So
Sure.
the other part would be about the billing, right? So the truth is a lot of specialists, right? So that they wanted to be a doctor and a specialist. Now they need to work and they need to have an army of admins that go and fight with the insurance to get their money, right? So as a result, many of them, they either close their own business and they joined together,
Mm-hmm.
or they joined the hospitals, right?
Mm-hmm.
Because they couldn't really afford paying for all of that overheads, right? So I think in the future, the way that I see the future is maybe we hire a lot of agents that fight with the insurance agents.
There you go. Agents fighting with each other.
Yeah, they talk to each other and then they can actually find a solution for us, right?
Right.
So I think a lot of that will come up, right? So I think these are the points that we need to improve a lot. Overall, the cost of healthcare went up dramatically. Even for the pre-screening, just a simple MRI, a simple CT scan, it costs in the U.S. 3-4 times more than the other advanced countries.
Wow.
So we can actually we can bring that cost down. We have more than 1 million people going elsewhere to get the medical care, right? While you have the best equipment, the best doctors, the best providers.
And we still have people leaving the country
That's very true.
to go get health care.
Right?
Amazing.
So these are the problems that we need to we need to solve. I think we have the way that I like to see is people from elsewhere come to US and get the help, not us going elsewhere to get a service, right?
Right.
So, and then from the medical side of it, purely from a disease, a diagnostic and all of that. I tell you my personal experience while I was doing my PhD, PhD work. So I want to break that up to two components. One would be sometimes you're segmenting on an image or you're that's that and use that as a baseline. The other part would be using AI to kind of read those images, right, and then come up with the diagnostic, right? And the truth is, even 5 years ago, 4 years ago, right, my models were doing better than a better segmentation than a lot of specialists, right? So the specialist technically was misleading my model.
Right? I see.
Right, but that is, we are not trying to replace doctors by any means, right? But what we are trying to do is have a second opinion, right? So imagine you're doing your job and your assistant tells you, okay, so maybe you have a bad day, right? So did you think about these things as well? How about this? How about that? I have friends who are surgeon, and they are telling me that still they're they are using AI just to as a second opinion and an advisor on the side, right? So a lot of this this is purely AI, but the other part the admin part is not really completely AI, but overall I think if you call it AI is fine, but overall I think the entire system we can actually bring efficiency, we can actually better performance, lower the cost, and in general help the public.
Yeah. There's a lot of opportunity, huh?
Absolutely.
Yeah. What about the innovation side? I mean, we're always trying to get better and we're always trying to improve, but how do we responsibly innovate? And this is especially, I don't want to say challenging, but important in healthcare. How can we continuously innovate in a field that, number one is sometimes behind, like retail and some of the other groups. And secondly, if something goes wrong, it can really impact humans.
Yeah.
So how do we responsibly innovate in AI for healthcare?
It's a balance between being aggressive and staying within pre-established guardrails. And so one thing that's fairly commonly practiced in the world of healthcare is the concept of human in the loop. We're going to innovate, we're going to move quickly, we're going to try to deploy agents. But when it comes to any medical decision, there's always going to be a human in the loop to verify. So we're going to capture efficiencies. We're going to get faster. We're going to take some of the admin work off of the providers and the nurses' tables, so that they can focus on healthcare
Decision making too, right?
Now, on my side of the world, which is less in the clinical setting but more in back office setting, you can be a little bit more aggressive. As long as you're not exposing sensitive data, as long as you're not making medical decisions, you can experiment and fail fast and learn from those lessons. So I'm definitely a big fan of the just try it. Move quickly, try it, and learn the lessons. If it works, great. Build on top of that. If it doesn't work, share that lesson with your team, share with the organization, and know that's one way that doesn't work, and then you can move forward. But we are constantly, let me not say we, I support the idea of, say, pushing the envelope of what is possible.
Right.
And just squeezing value out as fast as possible.
Yeah, makes sense. Saeed, what do you think?
I'd like to answer this question as from completely from academic perspective, right?
Okay.
So in academia, what we have is I have talents, I have resources, right, that can do magical things, right? But the problem that we're always facing with the medical field is lack of data.
I knew that's where you were going.
Okay.
Yeah, but the truth is, for instance, one of the data set that I used to work with is called Drive. That is for retinal, images. And that data, I think, is 20-something years old.
Oh,
it has
boy.
only 40 images,
Oh,
right?
boy.
So this is not something that I want to spend my time in, because at the end of the day, this is not practical. This is not how the world that we are living in, right?
Right.
I need to use as a base. That is different story, but in general, I really want to do something that is practical. Whatever model that we build, doctors can use it the next day, right? So lack of data is a problem. I think I don't see really a motive to solve that problem. I'm not, by no mean I mean sharing sensitive information to anyone and all of that. All of the data that we're getting is always sanitized. It's always we cannot track it to anyone.
Right.
All of that is always the case, right?
Now, how are you supposed to innovate, and how are you supposed to leverage these smart kids that are coming out and learning all these things if you don't have good quality current data?
Absolutely.
I see.
That's the first thing. The second part is sometimes you have data and then we don't have resources, right? So I remember when I was doing my PhD, I used to run my models in Microsoft servers, right? Okay. But I think because of the situation, the current situation and lack of GPUs and all of that, right? So those programs are not funded as well. So I need data and I need resource.
Right.
If I need servers, I need resources from industry, through the AI for Good or any other programs, right? So they can actually, if they give us that support and the data from the a brain power, we have a lot of talents in school, and I'm sure a lot of students love to see those things and jump on those projects.
Mm-hmm. So of the triangle of three things that are needed, the compute and those kind of resources, the data itself, and then the brain power, we've got one. But
we should push for the other two. So.
Yeah, push for the other two. And so a partnership with some of the medical and healthcare companies would help greatly to figure out how to innovate, which you could create new frameworks and new models, which then industry could use. And so help us help you kind of thing.
Absolutely.
Yeah. So maybe establish partnerships with labs. That's kind of your dream world, right?
Absolutely.
Yeah, I could see that. That makes sense. Well, that kind of leads into where you think healthcare leaders should prioritize next. And it sounds like from an academic perspective, maybe that's where they should prioritize, is by helping the academic community by creating these labs and coming up with these partnerships and developing an ecosystem. Did you want to add anything to that before I turn to Russ?
I think that's from the data side, right? And then from the from the ERP point of view, enterprise resource planning, right? So I think there's a lot of improvements. I think just as we started the talk, we mentioned all of that, and from from the hospital beds, efficiency on that, and there are so many different things, right? And I think just the last one that comes to my mind is about we can actually do a lot of diagnostic, right? And kind of a monitoring system that can prevent a lot of costs for us, right? For instance, I'll give you a number. We are spending around $400 billion in diabetes each year in the U.S.,
wow,
right?
Incredible.
And if you add the the entire money that you are spending for diabetes, it's around $600 billion, right? And then can we add a screen of retinal, and then you just by looking at, it's a very soft, you don't need a surgery, you don't need anything. All you need is just a simple ophthalmoscope, right? And then you can actually look at the shape of the vessels, and you can tell if the person is pre-diabetes or not, right? So if we add that, we can prevent that cost later. You see my point? So a lot of monitoring system, I like those costs to be lower. I like this, the healthcare system to pay attention to all of that and use AI for that, right? So eventually the overall cost will go down for patients, right? So I agree with Ross. I think that the point should be, from the academic perspective, data, computational resources, but let us help you guys, because we have a power, manpower, we can do a lot of different projects. But what I really want is a data that is it's real, it's usable, right?
Sure.
Not just hypothetical.
Right, and to help, it sounds like cost reduction. Yeah,
absolutely.
that's a big thing, and also getting in front of some of the costs that are going to happen later. Like if you knew in advance, you could do things proactively.
Yeah.
Okay, where do you think healthcare should prioritize when it comes to AI?
There's so many different areas.
I know, it's hard. That's the thing. It's so hard, so many opportunities.
Yeah, I rather than answering your question, I kind of want to address
go ahead.
what you're suggesting, and I'm supportive of this idea. But there's a fairly large constraint, roadblock, if you will, in that we haven't as an industry and as a country, I guess, with our laws, we haven't figured out a great way to make that happen.
Yeah.
We have very strong HIPAA laws and data privacy laws, which make healthcare administrators and chief information security officers and legal departments very nervous about what we do with our healthcare data. And I don't have a great solution. I would say that it needs to be a collaboration primarily between healthcare providers or companies and legislative bodies on how we could make this happen. How can we stay HIPAA compliant, maintain the privacy of all of our patients, but also create useful, usable data sets for academia to do these type of studies? I feel like there's I think probably what you're getting at is there's probably a plethora of hidden value in that data. And you have, I would say, low cost or even free labor in the world of academia. So yeah, I'm supportive of it, but
we just haven't figured it out.
We haven't figured it out yet. And from a healthcare provider perspective, our first priority is going to have to be protecting the patient and protecting the patient's data. So until a path is really blazed on how to do that, I don't know how we're going to get across that divide. And then to maybe try to address your original question of where should we prioritize our spending, I go back to one of my first answers. Don't worry about these big, gigantic things that we have to solve. We're not going to, curing cancer would be fantastic. And I think it will probably be expedited through the use of AI. It may not necessarily be because AI solves or cures cancer. It may be that the people, the resources, are spending less time writing manual reports because AI can take that off their plate and they can spend more time researching.
Right.
So try to find any kind of gain, the low-hanging fruit that we can find efficiencies, that we can lower costs, that we can return money into the system for reinvestment in research, into healthcare, into patient care, and just continue to create a flywheel of productivity that way. Meanwhile, the AI gets better every day, it seems like.
Yes.
Yeah,
So
absolutely.
it's not necessarily that we have to zero in on solving cancer or heart disease. Those things will come almost as a secondary result of us continuously producing efficiencies into our systems.
Right. Oh, I love that. I'm picturing a very, very good world here.
It will be.
It will be. It could be, right?
Absolutely.
So final question, Russ, what would you say to the academic world? You are a proxy right now.
Yeah.
What do you want from them? What can they do to help you, given, like, if we put the data aside, because that's not, we don't have a quick solution for that today, but what one thing would you want to see from the academic world to really help with healthcare AI innovation?
Yeah, that's a tough one. The way that you asked that question, it kind of reminded me of a conversation I was having with my high school senior son just 2 days ago. And he's having a bit of a existential crisis right now because he's going into his senior year of high school and he's thinking about college and what he wants to do. And I think his algorithm is feeding him all of this doom and gloom about how AI is going to replace the next generation of entry-level workers. And so my challenge to you in academia is, it's a tough one. You kind of have to, one, identify how do we adapt our teaching methodologies and our curriculum to prepare students for their entry-level jobs in a world where AI is easily accessible. And here's the kicker. How do you, let's say, negate the algorithms that our children are watching that are telling them that they're not going to have jobs and the world's going to fall apart, the economy's going to tank all because of AI, and instead inspire them with hope and say, all right, what can you do about it? right? Don't get lost in these big details about how the whole world's going to collapse. What can you do today? How can you adapt yourself and your skills so that you can be a productive member of society using new technology and skills that may not even exist yet?
That is a tall ask. I like it. I
No,
like it.
I love it.
Well, you get to ask him, besides the data issue, because we have a challenge with that. But what other things would you say industry should be doing to help academia with healthcare innovation and AI?
Sure. For that one, I think, if you look at the numbers, right? So like even in the developed countries, right? We have one ophthalmologist per 10,000 people,
Okay.
Wow.
right? So the number is so low, right? And then I'm talking like advanced countries. Forget about the third world, right? So that number is like way lower in the third world, right?
Sure.
So even in advanced country, like that ophthalmologist is busy enough with the help of helping those 10,000 people, right? So they cannot do any monitoring, anything like that, right? But the AI can, right? So like my ask is, let us help with their job, with the monitoring system, right? Give us the data, give us the computational power, and we can actually prevent a lot of costs later, right? So like just like diabetes, like if you detect it early, you can prevent a lot of costs, like billions and billions of dollars, right? So that is my ask from the industry. And to answer your question, Ross, the honest answer is I don't know, right? But we try, right? So the way that I see the AI, the overall AI impact in the healthcare, in anything else, right? So you should think of this as the impact of computer in our world, right? Go back 30 years when the computer came along, right? So as a banker, as a healthcare provider, right? You didn't need a computer. You were doing like just fine, right? But then the world became, the world changed, and then you had to adopt computers, right? To the point that if the computer is not working in your healthcare facility today, I'm sure you'll be facing a lot of troubles, right?
Yes.
Yeah.
This is AI is at the point that it's not going to go anywhere, right? But it will shift a lot of jobs. It will whether we like it or not, whether we face it or not. This is our new reality, right? So 20 years, 30 years from now, we look back and said, what, AI impacted all industries, right, including healthcare, right? So we should just adopt it, right? But from what I know is this is the advice I always give to my own students. I tell them, I know in 5 years, 10 years, you have the domain knowledge, right? And then just try to use AI in different fields, and I'm sure you will be very well paid off. And after that, I'm not sure, maybe somewhere in farming, but I buy a farm and go farming. But in 5 to 10 years, if you apply all of this AI into different fields, I'm sure you can actually make a lot of money, and you can be happy for yourself, your life.
That's a good pep talk. I like that. I like that. Very good. Well, thank you both for participating in this episode of Robinson AI Talks, where we covered healthcare AI from innovation to real-world impact.
Thank you.
Thank you so much.